Hi, everyone, and welcome to IsisParenting's Breastfeeding Chat and Learn. My name is Nancy Holtzman. I'm here in Needham, Massachusetts at the home office of IsisParenting, and with me today is Becky Morgan. Becky is a childbirth educator, a doula, a licensed massage therapist, and a licensed mindfulness practitioner, and she will be moderating today. Today, our topic is tips and tricks for better pumping. So I'll cover some of the basics, but I'm going to go beyond the basics and talk about some lesser known pump tricks and techniques so that you can get the maximum output and benefit from the equipment that you're using. I'd like to remind you, if you're new to chat, that you can put in your questions in the general Q&A box, and those will come over to me confidentially. I read those out loud but don't name names, and then I answer the questions to the best of my abilities. And it looks like we'll be having a few more people logging in and joining us, so I can take a couple of questions to begin and then move into the topic for today, and then I'll answer additional questions at the end. I see a lot of familiar names in the chat box, and in particular, someone might have wondered what the heck is super swaddle and Wombi, because I mentioned that to a friend, Jason, who I saw earlier this week over at IsisParenting. And the super swaddle technique is a swaddle technique, very specific swaddle technique with the arms down, that is beneficial to help override the baby's Moro reflex, the startle reflex, and also the reflex that babies have to flex the arms and draw the arms toward the face. And although those are very natural infant movements, they do tend to disrupt the baby's sleep when they're in a light sleep stage. So when you're trying to get a baby to sleep on his or her back on a firm, flat surface, separate from a parent, which is what the American Academy of Pediatrics encourages parents to do, it's hard for very young babies to sleep that way. It's not a particularly natural place for them to sleep. As many of you know, they would much prefer to sleep on you or next to you. And so sometimes we got to help them out a little bit if we're trying to get them to sleep in a bassinet or a crib and not cuddled up next to a parent's armpit. So the swaddle technique is using a thin, stretchy swaddle blanket. The arms are down, and we can wrap the baby snugly, allowing hip flexion, which is better for the baby's hip development, and allowing full lung expansion so they can take plenty of deep breaths and not worry about any of the concerning factors that improper swaddling results in. The Wombi is a very cool product that is kind of like a stretchy lycra body sock, and it really is like a womb that you zip up around the baby. It's very easy to use, and it keeps the baby from startling and from waking themselves up with their hands. Oh, Becky's got the link right up there. Awesome. Okay, I'm going to take one question and then we're going to get started with our topic of the day. So here's a question from a mom who wants to know: does power pumping, 10 minutes on, 10 minutes off for an hour, work when the babies are well past a month old to increase milk supply? If not effective, are there any suggestions to increase supply at 7 months? Okay, so that does fit in very nicely with the topic of the day. Now, a lot of lactation consultants and other people will talk about power pumping, and different people mean different things by that term. So you're defining power pumping, meaning setting the pump up and pumping for 10 minutes and then taking a break, doing something else for 10 minutes, pumping for another 10 minutes, taking a break, and so on. And what the power pumping is intending to do is to trigger increase in milk-making hormones, and over time trigger increase in milk production by telling the body that more milk is being requested than what the body has readily available. There's a lot of different ways you can do that. I'll be talking about today another type of power pumping version that I like to use, which is pumping after breastfeeding numerous times throughout the day. So if, for example, you're home with your baby and you're trying to increase milk production, maybe you're breastfeeding and then you could express milk using a breast pump for 8 or 10 or 12 minutes after breastfeeding, and then 2 or 3 hours later or an hour later you're going to breastfeed again, and same thing right after you finish breastfeeding to pump for an additional 5 to 10 minutes. And if you do that 3 or 4 times or more, preferably over the course of a 24-hour period for a couple of days in a row, that also does a very nice job at serving to increase your milk production. And although milk production is the blueprint for full milk production is most critical during the first several weeks after birth. That's when your body is really laying down prolactin receptors, and if there's not enough stimulation and emptying during the first month after birth, that can and will have a longer term negative impact on your overall milk production. But milk production is still malleable during lactation. So you will also find even a mom who has an older baby or a toddler, if the baby, for example, gets sick and is cranky and unhappy, they may have a sore throat. For example, they may stop eating solid foods. They may decide they just want to cuddle and nurse on and off for a couple of days in a row. So they may increase their nursing time at the breast, and then they get better, and then they start eating their Cheerios and their chicken and so on. And mom finds that she's got new engorgement because even the older baby was able to stimulate increased milk production by demonstrating an increased need or desire for milk. So milk production is malleable, with the exception of adding estrogen to the mix. So estrogen-containing birth control pills or pregnancy. Those are really two main things that are going to decrease milk production. Aside from that, you can increase your milk production by requesting and demanding more milk than your body has readily available. Okay, so let's see. Here's one quick other question, and then we'll move into our topic for the day. When you're breastfeeding and not doing any bottle feeding yet, when do you pump to build up your stash for when you go back to work? That's exactly what we're going to talk about today in a little bit of detail, and I'll give you resources for more detail. But the answer to that question is, first you breastfeed because the baby comes first and you want the baby to get any and all milk that's available whenever they want it. And then you pump directly after, and you can layer a little more milk and a little more milk and a little more milk in the same collection containers just by refrigerating and reusing, and you can do that 2 or 3 times throughout the course of a day. And even if you're just adding half an ounce or an ounce each time, by the end of the day, pumping 2 or 3 times, you may have a total of 2 or 3 or 4 ounces of breast milk that then can go in the freezer. Or if the baby is 3 or 4 weeks old, I suggest at that point alternating between feeding the fridge and feeding the freezer, so that Monday, Wednesday, Friday, you're putting milk in the refrigerator, and that's the milk that you can use to introduce a bottle and to keep the bottle familiar for the baby that ultimately will need to take a bottle. And then the other 4 days, the milk you're expressing goes in the freezer, and that's for longer term storage. Okay, so today we're talking about 5 tricks and tips for increasing your milk output and having more milk in a streamlined process while you are pumping. And I have an hour-long webinar that goes into expressing, storing, and feeding milk in much greater detail. This is an overview of some specific lesser-known tricks and tips. So to get started, I want to assume the basics, which of course is a big assumption. But when we're talking about getting the most from your breast pump, you have to kind of look at the equipment on hand. And so I'm using some assumptions here that everybody is using a high quality pump that's in good condition. It's not a really old pump or a pump that's been used by so many people that the motor is starting to get weaker and not cycle as quickly. I have a strong preference for double automatic breast pumps that will pump both breasts in the same amount, that will pump both breasts at the same time, and don't require you to do a lot to control that. The correct flange sizes, and that's going to be critical. The flange is the cone that fits over your breast, and the flange is what helps draw the nipple and areola using vacuum to produce compression, which ultimately is what's going to remove the milk. So the flange size is important because just like a pair of shoes, not everybody uses the same size. And breast pumps typically come with a standard size flange, and that works for many people. But pumping should be both comfortable and effective. If pumping is not comfortable, add a little drop of oil, olive oil, and if that doesn't help, then chances are you may need a larger flange size, as long as it's not your vacuum that's cranked up too high. We'll talk more about flange size in a little bit. And then your power source. If you're using a pump that has an external battery pack, I strongly recommend whenever possible you plug into the wall. You're going to get the best cycling speed and best performance from your breast pump when it's fully charged or plugged in. If you're using a pump like a Symphony or a Freestyle that has has an internal battery, those can be charged up and they will pump very efficiently and very effectively with the internal charge. But a pump like a Hygia or a pump and style that runs on external AA batteries, over time, as the batteries fatigue, you're going to lose efficiency and lose cycling speed. So avoid using actual battery unless it's essential. Plug into the wall, and if you do find yourself in a situation where you'll be using your car to pump, definitely invest in the vehicle lighter adapters. We do have the Medela vehicle lighter adapters for the breast pumps here in stock, and those can really help for people that do a lot of traveling or driving or are exclusively pumping. They may find themselves in situations where they need to be pumping in their car, but not when they're driving. Okay, so one of the most critical points I can make is the importance of double pumping hands-free. Pumping both breasts at the same time, you are going to get more milk in less time. So you could pump one breast for 10 minutes and the other breast for 10 minutes, and that would take you 20 minutes if you're good at math. And if you double pumped both breasts at the same time for 15 minutes, you would probably save time and yield more milk. So the double nipple stimulation causes an increase in your prolactin levels, and that's your longer-term milk-making hormone, and it creates a surge in your oxytocin response, and oxytocin is the hormone that's responsible for making the tiny little contractions in your breast that push the milk down and out. So double pumping means you're going to get more milk in less time. In order to double pump, I strongly recommend pumping hands-free because pumping is a time suck, pardon the pun, and especially if you're at work or if you're pumping 2 or 3 times a day at home after breastfeeding, you do need your hands. You need your hands available to do massage and compression, to tend to your baby, to eat, to type, and there's nothing like a hands-free bustier to free up your hands, and also having wrist issues, tingling, numbness, shooting pain up and down the hands, the forearms, the thumb, and the fingers is very, very common postpartum. So being hunched over your breast pump with your hands at funny angles does nothing to help your wrists. So please invest in a hands-free bustier, and that Simple Wishes one here that I showed you and that I linked to is truly the best one available. I have seen them all, I've played with them all, and if a better one comes around, believe me, I'll replace the Simple Wishes and let you know what it is. But for now, this truly is the best one. And you cannot make something almost as good by cutting slits in a jog bra, for example. Okay, so double pumping hands-free is important, but then I mentioned hands-free but hands-on. So hands-on means you're doing massage and compression while you're pumping, and that actually is shown by research to increase the fat content, and it helps lead additional milk letdown and helps the milk move its way out. If you're prone to clogged nipple pores or blocked ducts, doing gentle massage intermittently while you're pumping can help work out some of the fullness. And you don't need to be massaging your breasts during the entire pumping session, but some people find that doing a little bit of breast massage is helpful to initiate the milk to let down. Some people find that midway into a pumping session and toward the end of a pumping session, they'll yield additional milk. And some people find it's very helpful if they tend to get fullness in certain areas of the breast. So remember, hands-free but hands-on. That means you don't just put the flanges or the cones over your nipples and then forget about it for 15 minutes. You have to actually do a little bit of work while you're pumping, but it's just intermittent. Now, I put a link here for a really fantastic video. Who knows what NSFW means? I'll look in the chat room and see if people know what that means. And I do encourage you to watch that video, but just be cautious where you're watching it, as I said. Oh, it says multiple attendees are typing. Everybody knows what that means. Okay, so it's a fabulous teaching video from a great lactation program at Stanford Hospital and Stanford University, but it's very graphic. It shows a lot of breast pumping and breast massage while pumping techniques. So watch that at home, but it's a great one. Okay, you want to get the most out of your breast pump by using the cycling speed and the vacuum strength to the best advantage. So here are 4 good breast pumps. Let's see, I'll go clockwise, starting from the upper left. The yellow pump is a freestyle, probably my favorite pump because it has an internally charged battery and it can clip on to your waistband, your belt, or your pocket. And that plus the hands-free bustier, you are completely mobile. You can walk from one room to another. You can stand at the kitchen counter and shove food in your mouth, and so on. The pump on the upper right corner is a Pump and Style Advanced. I think that's probably the most popular breast pump in the United States, another Medela pump. Down in the bottom left corner, that's a Hygieia pump. It's also a very nice, high-quality pump, a little less expensive. Doesn't come with quite as many fancy features, but it still seems to be a pretty reliable option. And then bottom right is the Amita Purely Yours, and that's another decent choice. In terms of using your vacuum strength and your cycling speed, the vacuum strength is a very individual adjustment. So your goal is to try to find the maximum vacuum strength that's still comfortable for you. So basically increasing the vacuum strength just until it's no longer comfortable and then backing it down very slightly. That's your goal. And the vacuum strength that's comfortable or that you tolerate can vary from day to day or time of the pumping session. It can vary whether your breast is very full or toward the end of a pumping session, your breast is softer. Some people like more vacuum toward the end to draw more milk out. Other people are more sensitive or the breast tissue is more stretchy toward the end of a pumping session, so they may turn the vacuum strength down. There's no goal or recommendation here in terms of me telling you where to put your vacuum strength, except to always find the maximum vacuum strength that's still comfortable for you, and that's what's going to be the most effective. When it comes to cycling speed, you can trigger additional milk letdowns, or you can alter your cycling speed to do different rhythms, and sometimes that can be very beneficial for moms. So if you have one of the Medela pumps, I would encourage you to think about the milk letdown button as simply a toggle switch. Just think of that button as that it toggles back and forth between the rapid and shallow sucking rhythm and the longer, slower, deeper draw. And instead of watching for your milk to let down and paying attention and hitting the button and so on, just think of it as a toggle switch. So you turn the pump on, it's going to go rapid and shallow for 2 minutes. All on its own, it's going to shift to that longer, slower, deeper draw. After another 5 minutes or so, when it seems like your milk flow may be beginning to slow down a little bit, hit the toggle button again and get a second rapid stimulation mode. It will cycle very quick again for 2 minutes, and then it will shift to the longer, slower, deeper draw again. Some women will find toward the end of their pumping session, they like to toggle back and forth between the two different pumping speeds. If you have a freestyle, you can even make up your own pattern and then hit the memory button, and it will repeat the pattern for you next time. The bottom left corner, the Hygieia pump, that's the white pump with the orange buttons there. That one is nice because you really can play with both the cycling speed and the vacuum, and you can come up with a lot of customizable rhythms. So cycling speed and vacuum, those are two very effective adjustments to yield more milk. This is an important one. Very few people know this. So this is adjusting your nipple angle to change where the maximum compression is occurring on the breast tissue. And again, these cones are called flanges, and they do come in different sizes. Now, when someone sits down to pump, usually they very carefully try to line their nipple up evenly like a bullseye and center it exactly in the flange. That's fine, and that's what you can do. But don't assume that that's the only position that you can and should pump at, because just like your baby may latch, unlatch, and relatch slightly differently, or you may find that you can nurse in the football hold and then in a cross cradle hold. They're two very different types of compression, and they help actually stimulate different areas of the areola and the breast. So when you're pumping, you can shift the angle that the flange sits on your nipple and change where most of the compression is occurring. So in the first image on the left, you see that that's Mia's thumb, and it's perfectly centered in the flange. So there's going to be compression evenly all around. And then the middle picture, the the nipple would be pointed up, the flange angle shifted, and you can see clearly that there's more compression at the bottom than at the top, and then exactly opposite on the final picture. You can see with what would be the nipple angled down slightly, shifting the angle of the flange. Now there's more compression up at the top. You can pump off-center or asymmetric with your nipple all the way up against the side of the tunnel if that does not hurt. I don't want it to be uncomfortable. It shouldn't pinch or feel like an uncomfortable friction, but you may find, especially toward the end of your pumping session, pumping off-center all of a sudden begins to increase the spray of milk, or you may find that more milk is all of a sudden being removed when you shift the angle. So several times during your pumping session, shift the angle that your nipple is sitting within the flange. And then finally, my last tip for pumping is only good for people that are pumping for healthy full-term babies in the community, so that there's no issue, with bringing milk into a NICU or immunocompromised babies and so on. But a shortcut that a lot of moms will use is to refrigerate and reuse their pump parts in between use. And this is very helpful for moms that are doing the type of power pumping I mentioned at the beginning, where they're breastfeeding and then expressing milk right after breastfeeding, pumping for 5 or 8 or 10 minutes, expressing a very small volume of milk. You can unhook the tubing, stand the bottles up in 2 coffee mugs like in the picture, and that's just so they don't fall over, tent a plastic bag over the 2 of them, and then 2 or 3 or 5 hours later, you can pull those out of the refrigerator, hook the tubing back up, and pump again after your next breastfeeding session. So in other words, I'm suggesting refrigerating and reusing, and yes, just layering on a little more milk and a little more milk and a little more milk 2 or 3 or 4 times throughout the day. And that's a very good way for someone who has a young baby to begin expressing milk, wanting to store up a little bit of milk so that they can offer a middle of the night bottle, or can begin to put 2 or 3 or 4 ounces of milk a day away in the freezer for longer term storage, without taking milk away from the baby or trying to figure out how the heck they can pump while the baby is nursing frequently and unpredictably. So again, the best way to do it is to pump after breastfeeding and double pump hands-free, hands-on with your bustier, because like you saw in the early pictures, after breastfeeding, don't assume that your baby is going to be, all content and sound asleep for 3 hours in their bassinet. That's the Hollywood baby. That's not the real life baby that lives in your home. So what you might need to do instead, I'll go back to one of these pictures, what you might need to do instead is set yourself and your baby up so that you're sitting right next to your baby. Like here's Susan on the purple couch up in the corner. She's got her baby propped up in a boppy. She's double pumping hands-free, and she's reading her baby a board book. So that's an example of keeping a baby happy. Bottom picture, of course, that's an older baby because 9 months old. He's sitting up nice and strong and so on. But even a 3-month-old baby you could be having in a bouncer seat or propped up under the little play arch. You can dangle a toy. You can give them back their binky and so on, so that you can be right there hands-on with them while you're double pumping hands-free. So if you are doing that little trick with refrigerating and reusing your pump parts at home, you can be layering the milk if you're pumping after breastfeeding, because it's very small volumes of milk. When you're at work, you're going to be pumping instead of breastfeeding rather than in addition to, so you will be needing new bottles each time, because you'll be putting more milk in the bottle. So typically, if you're going to be away from your baby for a 10-hour period, you'll need to pump 3 times during that time frame, and therefore you'll probably need to bring 6 bottles with you so you can double pump 3 times. And when you get home, you can wash everything thoroughly, but when you're at work, you could try either refrigerating your pump parts in the work refrigerator, or if you have a cube or an office space that could accommodate it, bring in your own little cube dorm-size refrigerator so you can keep your stuff chilled right there. And if that's not possible, then get yourself a larger cooler bag, and then you can put your pump parts in a ziplock bag and use 2 or 3 bottles of frozen water that you can use as your cold pack, and then that will keep both your milk cold and your pump parts in a Ziploc bag cold. And intermittently, as you're in and out of the bag during the day, you can be drinking the ice water as it slowly melts. When you do get home, wash everything thoroughly. That means using a bottle brush and dish soap. Take all the little bits and pieces apart so you can clean everywhere, and then you can wash well, rinse, air dry, and you're good to go for the next day. A lot of questions typically come up about the increased milk production and, how do you increase milk production? And again, pumping after breastfeeding certainly can help, and especially if you're trying to store milk away to get ready to go back to work. But it's always important to try to find out, well, what is causing the decreased production to begin with? Is the baby not transferring milk as well? Is there a lot of supplementation going on? Is it on the baby side, the mom side, and so on? So making sure that you're getting some skilled breastfeeding assistance to fix the latch, make sure breastfeeding is comfortable, learn how to keep your baby awake and transferring milk at the breast, pumping after nursing if necessary, number one, because that can help boost your milk production without taking milk away from the baby, and number two, bit by bit by bit, by the end of the day, you'll store up several ounces of milk, and that can be used as a supplement if necessary. If your pediatrician has recommended that you do supplement because the baby is jaundiced or not gaining weight well or not nursing well, then again, I highly encourage you to seek skilled breastfeeding help, because when you want to be breastfeeding, feeding the baby supplements of formula is not going to fix the problem that led to the need to supplement the baby with formula. So whether it means you need to be increasing your milk production or helping the baby learn to breastfeed better or more efficiently, and sometimes that's a tincture of time. If a baby is a 37-weeker who's a little bit sleepy and a little bit jaundiced and comes to the breast and nurses for 3 minutes and then promptly falls asleep, that baby is probably not going to be able to keep himself awake and do a great job transferring milk for a couple of weeks. And so it may be important to do a combination of direct breastfeeding, pumping, and alternate feeding the expressed breast milk. But in that type of situation, adding large volumes of formula is not going to fix the situation. It may make the baby a little bit less jaundiced, but it's not going to help the breastfeeding, and it's not going to it's going to have a downward spiral effect on milk production if mom is not pumping and removing milk regularly. And if mom is pumping and removing milk regularly, then she's got the breast milk that she can be using to supplement rather than the formula. If you have more questions or want more detail on these types of topics, I put a link into the low milk supply concerns webinar, which is an hour-long webinar. And again, just as a reminder, there are many paths to breastfeeding, and sometimes people begin breastfeeding by bottle feeding. Sometimes babies come early or have jaundice or other reasons for needing supplementation. But remember that the most critical thing is to feed the baby and then to initiate and then maintain your milk production, so that when you and the baby are ready, those pieces of the puzzle can come together and the baby can breastfeed directly. The picture at the bottom, I think a lot of people look at that and see a crying baby, but most lactation consultants will look at that and say, wow, look at that tongue tie. So that baby, you can see there's like a little extra flap of skin at the bottom of the tongue, which is keeping the baby's tongue from extending, and it keeps it kind of anchored to the bottom of the baby's mouth, and that can be a very big breastfeeding challenge. So that's why I put that in there. While I'm on the topic of pumping, I wanted to let you know that here at ISIS, we ran a nice offer, and there's only 3 more days. It ends on July 1st, and you can order online or in our centers either a pump and style advanced or a freestyle, which are 2 excellent pumps, and there's all these free gifts with the purchase through I think that's Saturday, quick clean bags and the milk storage bags and bra pads and so on, and if you're not local to Boston, those pumps both ship free, so you can get free shipping and the free gifts with these pumps. And if you are in the Boston area, you get to come to Pump Talk for free, which is an in-center class, 2 hours on expressing, storing, feeding pumped milk, and answers to your specific logistical questions. Other resources to let you know about, and then I am going to go on and do a few Q&A, is the recorded webinars. So just as you click through to get to this webinar today, there's a long list of previous week's topics that you can watch and listen to at 3 o'clock in the morning if that's your preference. But tying in with today's topic, the expressing, storing, and feeding breast milk webinar goes into a lot more detail and specifics on storing the milk in the freezer, and when do you use milk storage bags, and how do you bottle feed to protect the breastfeeding, and so on. I did a working in breastfeeding webinar with Bright Horizons a couple weeks ago, so I put the link on that. Low milk supply I referred to earlier. Also, there's ones on oversupply, on starting solids, on reflux. You name it. There's lots of topics there. If you are in the Metro Boston area, please do come to the Pump Talk class and we can talk in person. I just taught that class yesterday in Arlington and had a great group of, I think, 9 moms and 10 babies there. It was very nice. Next week, we're going to talk about treating sore nipples. So put that on your calendar now, and please help us by spreading the word, because I think this breastfeeding webinar is now about 6 months old, maybe 8 months old, and we're always trying to validate the time and effort that we're putting into it. So the more people we get, and especially people from all over the country, is what we're looking for. So please help us grow the audience, and of course follow us on Twitter, ISIS_parenting, and myself. If you have Twitter handles, put them in the chat room, and if people are on Twitter, we'll all follow each other. Okay, I'm going to take a couple of questions. Let's see. Here's a question. Actually, I'm going to change the deck. So let me do that. I have one question pending. So if people do have specific questions, now is a very good time to put it in the Q&A box, and you will rise to the top of the questions while I change the deck. Hold on a minute. Let's see if I can figure out how to do this. There we go. I think that worked. Okay, let's see. Oh, I see a lot of comments. I'm looking in the chit chat box. I see a lot of comments on tongue tie. And boy, tongue tie is a tough one. It's not always picked up when it should be, and can certainly cause a lot of breastfeeding challenges. Typically, I refer to the mom with hamburger nipples. Sometimes you can diagnose a tongue tie simply by looking at mom's nipples. Not always, but there is sort of a classic hamburger raw nipple look of the mom with tongue tie. Okay, here's a slide I like to talk about, some of my very favorite breastfeeding support items. And a lot of people might say, well, what do these have to do with breastfeeding? And really, these have a lot to do with normal newborn temperament. And normal newborn temperament has to do with breastfeeding because a lot of people blame normal newborn issues on breastfeeding when in fact they're baby issues and not breastfeeding issues. So for example, I think I have a nice little list of some of the freaky things that babies do. Young babies want to suck constantly. They want to nurse pretty much all the time, and if they're not nursing and dozing, they still want to suck. It's very common to have a baby that falls asleep at the breast, but then when you try to take them off, they either wake up and fuss frantically that they weren't finished, or you can take them off the breast and put them down for a nap, but well within 20 minutes they're awake and flailing and screaming until they're back at the breast. And so that type of behavior begins to make a parent think that the baby isn't getting enough milk at the breast, is still hungry, is a snacker, is not an efficient eater, and maybe there's an issue with milk production, when in fact that's very normal newborn behavior because young babies are close contact species and basically want to be held and moved all the time. I think it's a pretty classic example that if you hold your baby on your chest or wear your baby in a sling or a carrier, your baby may easily sleep for an hour and a half or 2 hours if you're sitting or walking or moving. But as soon as you try to transfer a sleeping baby down to the bassinet or crib, the likelihood that that baby is going to continue to sleep and stay asleep for an hour and a half is very, very low. So remember, the close contact species, babies want to be held and moved skin to skin or up against you almost all the time. Cluster feeding is also a common baby pattern where babies may want to eat 2 or 3 or 4 times in rapid succession, and then may kind of crash out and sleep for an